Hi, I'm Dr. Weingarten from Weingarten Psychological Services. I wanted to talk a little bit today about a coping skill called deep breathing. Deep breathing helps us to manage our stress and anxiety levels. Not only does it help in the moment, but it helps over time. The more we practice it, the lower our baseline anxiety is. That means we have more of a threshold or a buffer before we get to a point where we are actually distressed or even in panic. To understand this, we need to understand a little bit about our nervous system. I like to think about these two parts working almost like a seesaw. On one side is our sympathetic nervous system, and on the other side is our parasympathetic. Our sympathetic nervous system is activated when we are anxious or afraid or stressed. And it causes things like increased heart rate or rapid and shallow breathing. It might even pool our blood to our vital organs to protect ourselves and prepare ourselves for an outside threat. These things are important when we face an actual threat or a challenge, but they can also backfire when we're anxious and things aren't truly dangerous to us, or when they're constantly, chronically activated and they become dysregulated. They don't turn off on their own. But we can use skills like deep breathing to help to balance out that seesaw. So deep breathing helps us to slow down our physiological arousal. It slows down our anxiety in terms of our psychological experience of it as well. Practicing it over time can help us to calm down for the day if we do it in the morning. It can help us to go to sleep when we practice it at night. But it also lowers that baseline threshold of our anxiety. So it's an important skill to work on over time. The better you get at it, the faster you can use it, say, at a moment's notice when something unpredictable happens. To think about this, I like to think about a baby. Many of you have probably seen a baby sleeping in their crib, maybe lying on their back, and you see their tummy moving up and down. Now think about when you see a baby crying. Is their tummy also the thing that's primarily moving? No, it's usually their chest, right? A lot of times, even after a baby stops crying, they're having trouble catching up. So if we put one hand on our belly and one hand on our chest and just take a few breaths as normal, we might be able to tell our level of physiological arousal and activation. Over time, as adults, we start to carry more and more stress. We start to breathe more and more from our chest, like the baby that's distressed and crying. But with practice, we can shift that down to breathing from our stomach. We can lower our physiological arousal in the moment when we're distressed, but also over time, fighting chronic anxiety and stress. So now that we've taken a few breaths and seen where our breathing is going, our chest or our stomach, let's try to intentionally shift it down to our stomach. Which hand's moving now? For some people, this will be pretty natural. For others, it takes a lot of work. Take your time. Don't become self-critical or judgmental. If it's troublesome, it just means that you need to practice. It means it's an important skill for you to learn. The next step is to slow down your breathing. There are all sorts of models for slowing down our breathing. I like to use 4 seconds in, 4 seconds out. You can do longer, but sometimes people find themselves getting dizzy or having difficulty with it, and that's just not worth the potential added benefit. So, putting your hand again on chest and stomach, take a couple breaths, make sure that your lower hand is moving. Now we're going to count. In, 2, 3, 4, out, 2, 3, 4, in, 2, 3, 4, out, 2, 3, 4. Continue practicing this at least twice a day, morning, evening, and I also recommend anytime you notice yourself becoming activated. You won't always need to put your hand on your chest and your stomach. You won't even always need to think about 4 seconds in, 4 seconds out. At this point, I find that I can do one deep breath and let it out slowly. I tend to imagine kind of like letting go of balloons filled with helium, and my anxiety or my stress floats away. I also like to imagine my body feeling calmer, relaxed, and heavier in the chair as I do this skill. Before bedtime, if I know I've been carrying a lot of stress, I'll often lay on my back and do some deep breathing and feel myself getting heavier and heavier in the bed. And when my body's calm enough, I roll over and fall right to sleep. I hope that this was useful, and I plan on adding some more videos. So please follow us and let us know if this was helpful. We're happy to have any good faith feedback, and thanks for your time.